So there are some differences depending on where you look. And you can think of this in 4 stages. So stage 1 is you are asymptomatic, but already your PET scan may show changes. You may already be collecting some amyloid. You may already have changes in your glucose utilization in temporal and parietal lobes. Stage 2 is SCI, subjective cognitive impairment. You know something's wrong. Often your spouse may know there's something wrong, but you're still testing within normal limits. Now, you may have started very high and you've come down for you, but you're still testing within normal limits. So that is SCI. Then, and that may last 10 years or so, then there's MCI, which is mild cognitive impairment. And by definition, then, you're not testing normally anymore, but you still can do your activities of daily living. And then the 4th stage, and the last one, of course, is Alzheimer's disease, where by definition, you've now begun to lose your activities of daily living. So the bottom line is, it's easier earlier on, and this is why we recommend everybody who's over 45 should have a cognoscopy. Just like you have a colonoscopy when you hit 50, you want to look to see, you want to get your blood tests, you want to get appropriate baseline, which you can do online, actually looking at your memory, looking at your executive function, looking at your praxis and gnosis and things like that to see where you stand. And if you're symptomatic, you want to include a volumetric MRI. If you're not symptomatic, you can skip for then the volumetric MRI. And then you want to get on an optimal program. If it's prevention, it's a little less detailed, but you still want to shoot for that mild ketosis. You still want to optimize all the various numbers, your various metabolic parameters, and you want to make sure that you don't have toxins on board that could be hurting you in the future. The farther along you are with symptoms, the more you really have to pull out all the stops. You really have to address everything, and you have to look to see, do you need a specific detox program? Do you need specific treatment? We find a number of people, for example, will have been treated for Lyme disease, but not for the co-infections. So you need to look at that, because anything that's causing you to have continued chronic inflammation is going to be a potential problem and contributing. If you look at the amyloid, it is really part of the innate immune system response. So the amyloid is telling you you're protecting yourself from some pathogen. So for people who have other disease states like diabetes and cardiovascular disease, no question, this same sort of approach can be very helpful. What we're looking into now, we don't have enough data to know yet, is whether this can be helpful if we now make appropriate changes, modifications for Parkinson's, Lewy body, frontotemporal dementia, MS, so forth and so on. And so we believe that with the appropriate biochemical modifications, you're addressing now a different pathophysiology. But there is overlap with what you see with Alzheimer's and what you see, for example, with Lewy body disease. And so the question is, can you now make appropriate modifications and optimize this for each of the neurodegenerative diseases? It's not quite as simple as just inflammation. It's also been called, of course, diabetes of the brain. It's not quite that simple. So we found that there are actually subtypes. So type 1 is inflammatory, and the predominant driver is this ongoing inflammation. The production of the amyloid is part of the innate immune system. Type 1.5 is glycotoxic. So the predominant driver of there is insulin resistance and toxicity from sugar. And as we heard earlier, sugar-related changes in proteins that are relatively widespread that you can measure with hemoglobin A1C as one of the many proteins affected. Then type 2 is trophic withdrawal. So people who've had loss, and again, women who've had early oophorectomies with suboptimal BHRT are at markedly increased risk for Alzheimer's disease. And that's type 2. And then type 3 is toxin related. And we're finding many people with what we call this type 3 Alzheimer's disease that have chronic exposure to mycotoxins or metallotoxins or organic pollutants and things like that. These all call out that amyloid response.